For the current administration, we wouldn't want to dwell on what has happened in the past, but we're coming from somewhere. And I can tell you that even for the federal tertiary health institutions, they are having a better deal now. We have funded more cancer centers in different geopolitical zones. We are refurbishing and rehabilitating many service delivery units in many of those big hospitals. I would like to quickly say that general hospitals and PACs belong to subnationals. So what we do at the federal level with our National Health Insurance Authority is to give appropriate guidance to states, and now with the enthusiasm being displayed by Algon, to support them to make sure that the facilities are at that level. Last year, we had a deliberate funding of the health sector, a departure from what has happened. Because with the Nigerian Health Sector Renewal Investment Initiative that is being implemented by the current administration, we did a diagnostics at the beginning of the administration. And we called major stakeholders to really know where are the pain points in the health system. Which one can we easily address? It's a long journey, but we have started right. Because increased funding, deliberate funding, even with the establishment of more federal medical centers, conversion of teaching hospitals in several states to improve access is currently ongoing. The budget may not be enough, but now the way we utilize it is now more efficient, more effective, and focused. Because in the Health Sector Renewal Investment Initiative that we are implementing currently, has a strategic blueprint with the contribution of all the 36 states of the Federation. We decided together this is the direction that needs to be, that we need to follow, and we are gradually following it. The subnationals have their own priorities and challenges as well, because we also expect secondary care facilities, the general hospitals, to be improved. One of the interventions we had to do to make sure that our money is invested properly is doubling the production of healthcare professionals. We all know what Japa syndrome has done to the country, and now there has been a deliberate effort by the current administration. Ministry of Health, working with Ministry of Education, has made a deliberate decision that university intake for medical students, pharmacy students, nursing, midwifery students, and other health professionals should be doubled. So that, and this will go with expansion of infrastructure and facilities in preparation for this increase in number, and then how to retain them. We are working on the migration policy for our health workers to ensure that our brain drain is converted to brain gain. And in the next couple of weeks and months, we'll be seeing Nigeria signing MOU with countries, major destinations of our health professionals, to see how whatever they've acquired, their experience and skills, can be deployed back home. On budgeting, what we know now is a significant departure from what we used to know. For the private sector, we are collaborating with them through the National Health Insurance Scheme. They redesign packages to make it more affordable and to address beyond malaria and other things that he mentioned, so that whatever you need in a household, this financial protection is there to the heart of the current president of the nation. That a household of 2-3 children, when 2 or 1 of the children has malaria and has to be admitted, then the household income becomes depleted. This is the financial hardship, our aggressive campaign to make more enrollment of people into the health insurance. And government is taking more responsibility. Like we just recently launched a maternal mortality reduction innovation initiative, MAMI, which has provided that any woman who is about to deliver and needs a cesarean section and is unable to afford it can be given that service free of charge. Government takes up the responsibility of paying for that. And we have close over 700 women that have benefited so far, but we are still signing MOUs with different hospitals.
That happen in the rural areas?
Yes, if they are able to refer.
How many health facilities are able to carry out cesarean sections?
Thank you very much. Part of the plan, like I mentioned, that we are in the process of implementing a particular project called Hope Health, is that we know what is happening in the rural areas. If the primary health care centers in the rural areas are able, they have the right staff with the right skills, they identify women and other people, men, children that need secondary services. Effective referral linkages are being established. This is the task we have given National Primary Healthcare Agency in collaboration with the state ministries of health to ensure that we smoothen this transfer. A woman comes to the primary healthcare to deliver, and they discover that, oh, she has twins, and one of the first baby is coming with the leg. That will need a cesarean section. They can easily evacuate, and that's why we launched the National Ambulance Emergency Medical Service and Ambulance System, NEMSAS. I'm sure they are working with Alliance Hospital, but the reach has not expanded to the level we wish. But they are currently running, and they have a code 112 that you can call if you see an accident victim anywhere. Ambulance system, one of the ambulances in the nearby hospitals that have subscribed, we move the accidented victim to the nearby nearest hospital, where this NEMSA scheme, we pay for the first 48 hours.
Okay.